Evidence-Based Practice in Nursing, Module 5, Lesson 2. What is evidence-based practice? I interviewed 4 of my colleagues. One of them was a staff nurse, another a new graduate nurse, my nurse manager, and a family nurse practitioner. I asked the 4 nurses if they could give me a definition of evidence-based practice nursing, and these are the 4 they gave me. Nursing by data collection, treatment based on studies and research, nursing based on evidence that produces quality care and good outcomes, and nursing care based on previous research and evidence. Evidence-based practice and evidence-based decision-making is based on external evidence, which is systematic reviews, randomized controlled trials, and best practice and clinical practice guidelines that support a change in clinical practice. And internal evidence, healthcare provider expertise, quality improvement projects, outcome management initiatives. And the patient, their preferences, and their patient's values. How is evidence-based practice used in our daily practice? Here were some examples that were given to me by our nurses that I interviewed. Preoperative antibiotic therapy, core body temperature measurements perioperatively, postoperative blood transfusions, and surgical prepping such as clipping and shaving preoperatively. Some barriers that can interfere with our evidence-based practice could be such as time constraints, lack of skill and knowledge deficits, doctor preferences, and hospital policy and procedures. When identifying a task that I do in my daily practice based on evidence-based practice would be preoperative antibiotics. Every surgery patient preoperatively receives IV piggyback antibiotics. It is documented and is also part of our surgical timeout. Our hospital protocol requires a 30-minute window if ANSEF is given and a 1-hour window to incision when vancomycin is given. National standards are measured by CMS. So as an overview of evidence-based practice nursing, this gives us the potential to improve quality, reduce variations in practices that result in the best possible outcomes for our patients, which is number 1. Thank you.